Hello, my name is Dr. Stelina Gowdy. I am a family physician practicing in Athens, Georgia at Gowdy Family Care Center. And today I'd like to talk to you about the difference between allergies and a sinus infection. Now, let's start with allergies. Allergies are usually triggered by pollen, dust, or sometimes could be triggered by pets. And your typical symptoms typically would be more clear, runny nose, sneezing, itchy eyes or throat. Typically, you do not have any fevers when you have allergies. And the best thing to start to help with those symptoms are antihistamines. And antihistamines would include things like cetirizine, also known as Zyrtec, or loratadine, also known as Claritin. Something else that can help is including nasal steroids. Nasal steroids would be a spray like this one, also known as Flonase. There's different options over the counter. The only one that I don't usually recommend that you use for a prolonged period of time would be something like an Afrin, because you can develop something that's called rebound symptoms, where you use it for a period of time, symptoms improve, but as soon as you stop, your symptoms come back, and it's very difficult to get off of the Afrin. So usually I recommend something more like Flonase or a nasal steroid. Also using things like a sinus rinse. I've got an example of one. There's many options over the counter, but this one, for example, has either a bottle or a neti pot, a sinus rinse, or even a bigger system like this one that could be used to help clear out the nasal passage. And when you're doing that, essentially you're removing all of these allergens that tends to trigger your symptoms. So definitely strongly recommend using that as well, because that can help you start to feel better a whole lot quicker. Also making sure that you're taking off your clothes when you're getting into the house. Go ahead and remove all of your clothing so that if there are some of those allergens, it'll also help with reducing your symptoms by removing your clothes or changing your clothes. Now, in contrast to that, sinus infection is a little bit different. Typically, when you have a sinus infection, you tend to have really thick yellow green mucus. You have a lot of sinus pressure or facial pressure, also associated with headaches, and sometimes you can even have fevers. And what can help with those symptoms include things like pain relief, using things like ibuprofen, also known as Motrin, or using acetaminophen, also known as Tylenol, can help with reducing the headaches or the pain that you're experiencing. Decongestants, such as pseudoephedrine, could be used to help with your symptoms as well. Usually recommend using something like a Claritin D or Zyrtec D. Those can definitely help you with your symptoms. They are available at the pharmacy without a prescription, but because they do have a risk of abuse, the pharmacist usually keeps them behind the counter. So you just have to ask for it, even though you don't need a prescription for it. Although some pharmacies do have them on shelf, but if you don't see it, just make sure to ask the pharmacist for it. And again, same thing as far as using a sinus rinse. Those sinus rinse can really help a lot. And you can use them multiple times a day. And the one thing that I would recommend when you use a sinus rinse, make sure that you're using bottled water instead of using tap water. And then making sure that you're getting some rest and that you're staying very well hydrated. Now, the big question that everyone asks all the time is, when do I need antibiotics? You do not need antibiotics right at the start of those symptoms. The recommendation is that you start with antibiotics after you've had symptoms for approximately 10 days. So if it's been going on for over a week, symptoms are not getting better, and that is when we do recommend starting antibiotics. Another reason why we may start antibiotics a little bit earlier, maybe if you're having very high fever or severe facial pain, or if you had symptoms, you started to feel better, and then you start to feel worse again. That's an indication that you may need antibiotics. However, the majority of the time, the infection is a viral infection, and that is the reason why we do not recommend starting with antibiotics as over time you do start to create antibiotic resistance. Now, if you're not sure what you have, don't self-diagnose. Here at Gowdy Family Care Center, we are here to help you feel better and help you get on the right treatments without unnecessary use of antibiotics. So if you'd like to reach us, if you're looking for a primary care provider, or if you have symptoms and you need to be seen, give us a call. Our phone number is 706-410-2684, or search us online at www.Gowdy Family Care Center, where you can even book your appointment online. Or we do accept walk-ins, and we are located at 1500 Oglethorpe Avenue in Athens, Georgia, Suite 3500. Follow us for more practical health tips from a provider you can trust.